Okay, so welcome back, everybody. In case this is anybody's first day, very, very quickly, my name is Catherine. It's really nice to meet you. I am a licensed mental health counselor, master certified addiction professional, qualified clinical supervisor. I reside in the state of Florida, and I do currently still provide counseling services to clients myself, as well as doing the consulting. So kind of part-time with both. So as I said yesterday, anything that I talk about or share, these are all things that I fully believe in and do myself in my regular practice. So nothing are things that I'm not actively doing right now. And so I do understand some of the challenges and things that come up as well with our clients and what types of issues we're seeing both in community behavioral health as well as in a private practice space. So, with that being said, let's talk about brief CBT techniques specifically. So we don't need to go through who MTM is. Let's look at what our objectives are for today. So we're going to start with just a really quick check-in, talk about that post-session practice questions. Now, those were the things that I said I was going to send to Melissa, and I forgot to do that, which is my fault. So we will just discuss that together. And then the bulk of what we're talking about today are these specific skills and techniques related to brief cognitive behavioral therapy. Of course, it goes without saying, these are all introductions to these models. There are so many different techniques and skills. We could be here for weeks talking about CBT and brief CBT. So, my goal here is to, number one, enhance skills that you already have, because I know that you are really already doing a lot of CBT, I'm sure. So, to talk specifically about brief CBT, how we move some of those CBT techniques into brief CBT. And as I said yesterday, hopefully to leave you with at least one new skill or one new bit of information or a refresher in something that may be forgotten. That's always my goal. So hopefully I'll achieve that today. And then we're going to end today by talking about strategies for ending treatment successfully, which is not always the easiest thing to do. So we're going to chat about that a little bit. And then after today, we will have completed our discussions about brief CBT. And next week, we will talk about dialectical behavioral therapy all day on Wednesday, and on Thursday about the clinical use of collaborative documentation. So that's what's to come today and in the future. So let's go ahead and get into it. So yesterday afternoon, we talked about the why of brief treatment, kind of a refresher on motivational interviewing skills, and that brief CBT sort of model introduction, as well as how you set things up for brief CBT. So since yesterday, have there been any questions that have come up, any other thoughts or ideas that anybody had that you wanted to sort of clarify before we move forward? Okay. So as usual, if anything comes up, feel free to put it into the chat box, or you can always email me. You'll notice my email is at the bottom of most slides. You can email me directly if it's something that you just want to ask privately. You can do that too. So what I was going to send to Melissa at the end of the day yesterday was this, but we can just talk about it. I know that you all are using, again, a lot of you are using some CBT skills already. You're probably doing some motivational skills, motivational interviewing skills. So we're really looking at, what do we feel most comfortable with? What were the skills that maybe we need a little bit more practice on? Basically, did anything come up during that training yesterday that we kind of went, oh, that's something that I need to spend more time on, or that I need a little bit more practice on? Was there anything that sort of popped up for anybody that made you think, I think I need to spend a little bit more effort on this? Okay, so if not, great. If so, and you want to share it again privately, you're welcome to do that. But again, the idea is really to just encourage you to practice it either together with a peer or with clients directly. Again, we're really working on with brief CBT and then with DBT, maintaining that fidelity to that model as much as possible. So getting back into the, yes, I know the theory and I know some of the skills, but how is it that I can go about doing this in the most with the most fidelity possible. So give this a practice over the next week. Give the skills today a practice over the next week with your clients or together with other peers, and just see where are your weaker spots. We all have them. So it's helpful to be able to identify and kind of take note of that little feedback for yourself. So getting back into brief CBT, let's talk about techniques today. So yesterday we covered how we do brief CBT generally and how we do brief traditional or how we do traditional CBT generally, and how those two things are different. Talked about the lengths of our stay. We talked about the differences in what we focus on. We also talked about who could be right for a brief CBT approach, because like any approach we take, not every single person is going to be correct, right? It's not a one size fits all thing that we do as therapists. We also talked about the general principles that are going to make brief CBT more effective, as well as the very, very important essential skill with brief CBT of structuring a session and that agenda setting. So we talked about a lot of those things. So now let's dive into those practical skills and techniques. So again, some of these are going to be things that you are familiar with or that you've done, but we're going to home in a little bit further on it for brief CBT, or give it a little bit more of a refresher if it is something you're familiar already with. So, of course, being cognitive behavioral therapy, we've got those two key words, cognitive and behavioral, right? And so when we're looking at the techniques that we're practicing and using with our clients here, we're separating those techniques mostly into those two categories. So we were going to start with that cognitive element. I think for most of us, this is where much of our work with CBT lies, is it is in thinking about thoughts and beliefs. So, as a refresher, or for anyone who's not as familiar with the ideas about our thoughts, our beliefs, and our core beliefs, let's talk about it just for a moment. So, what are they? We know that we all have automatic thoughts. Those are going to be the brief thoughts that pop into our minds about ourselves, about other people. But sometimes, of course, these are maladaptive. Those are going to be those distorted things that come into our minds that we just kind of accept as true, whether it's good for us or not. And maladaptive thoughts is really where we're sticking with brief CBT. That's where we do a lot of the cognitive focus with brief CBT. But in CBT, we start to then look at going a little bit deeper into the mind. We start to look at those intermediate beliefs, recognizing that our automatic thoughts are being formed by something that's already in our system. And so it gets a little bit deeper. If you look at that circle over there, getting a little bit deeper into our intermediate beliefs that are helping to inform those thoughts that we're having. And intermediate beliefs in CBT, we say these are the attitudes or rules that we generally follow, and it can be across a whole bunch of different types of scenarios. So it's not going to be situation specific. This is sort of that formulary of if X happens, then Y is definitely going to happen. And so we know our intermediate beliefs are often, again, helping to form and create those automatic thoughts for better or for worse. But these also have come from something. And so traditional CBT will frequently look at core beliefs. Hopefully, we have a lot of strong, solid, positive core beliefs about ourselves and about the world. But if somebody's coming to therapy and we're using CBT and we're doing traditional CBT, we're probably looking at dysfunctional core beliefs, because the functional ones are working great for us. It's not as much of an issue. The dysfunctional ones are the ones that are unhelpful. And we know a lot of times those core beliefs start to form in our childhood. It's where we learn about ourselves and the world. And when we look at this from this kind of circular perspective, it helps to make this really, really clear about how this kind of progresses. That core belief starts to lead into those intermediate beliefs, which are then leading into those automatic thoughts. But core beliefs are really, really held close in the center. And again, they've often been formulated all the way from childhood, early adulthood, as we've kind of identified how the world works and our place in it. So when we're thinking about brief CBT specifically, we're really targeting automatic thoughts. And in time, if we're targeting the automatic thoughts, what brief CBT says and believes is that that may also then start to impact intermediate and core beliefs. But with the brief nature of brief CBT, we're probably not getting into intermediate or core beliefs, because if we did, we wouldn't be doing it the justice that it needs. So when you think back to yesterday and we talked about who is right for brief CBT, you can think here, this is going to be somebody who needs some immediate relief from some of these kinds of negative thinking patterns or distorted thinking patterns. This is going to be somebody who has limited time, somebody who has a history of not participating ongoing consecutively, right? Somebody who has a specific problem they want to work on. Again, these are going to be the people who are most appropriate for brief CBT. So we do have time in brief CBT to really get into those maladaptive thoughts. And that's the big chunk of brief CBT's cognitive element. So, very frequently, when I am working with my clients and I'm doing brief CBT with them, one of the first things that I start right off with is let's start to identify those maladaptive thoughts and beliefs, those things that are popping into your mind kind of automatically. And as with everything, it's so, so important that we explain what it is that we're talking about, why we're talking about it to our clients right from the get go. So I like to start with them by kind of giving them clarity about it, that this is an essential part of our process. We want to identify what these thoughts are. So I really like to use for my more visual clients a nice little situation, thought, feeling triangle like you have on the screen here, just to help them really understand. Because so often, of course, what our clients are experiencing is they recognize this thing happened, situation, and I felt this way, right? They really are often not putting together or seeing because it's so quick, it's so automatic, the thought that happened in between. So I'll sometimes use this triangle if they're a more visual person, and I'll be able to say to them, this is what you see happening, situation leading directly to feeling, what we want to work on. And the goal of us working on this cognitive element in cognitive behavioral therapy is to make you more aware of this thought that's happening in between. And that's what we're trying to do. And of course, if we can do this and use their statements, their examples to help illuminate it a little bit better, that's going to be even more helpful. So an example of a back and forth with a client could be us talking about that check-in. How have you been feeling this week? And maybe the client tells us, well, I've been feeling really anxious. And that gives us the opportunity to say, well, was there something specifically that triggered your anxiety? And in this example, this client's talking about going to an ex's, picking up some belongings. That was the anxiety trigger. This is a great opportunity for us to ask them, well, was there a thought that you had about going to pick up those belongings? And maybe if this is a very self-aware person, they already can say, I just kept thinking that I'm never going to find anyone. Right? I'm so upset. I had to go to my ex's. I had to pick up these things. And I just was thinking, well, if I can't have him, I'm never going to find anybody. I'm going to be alone. This is so common, right? With our clients who are dealing with the end of relationships. And so if we can get them to sort of say this to us, then we have the opportunity to say, this is what we're working on, right? What you just described. I'm never going to find anyone. That's the automatic thought. You didn't have to put effort into it. You didn't think about thinking about the thought. It just, bam, was there and you felt anxious. This is why we want to spend time identifying these thoughts, because it's not the situation that made you feel anxious. It's the thought that made you feel anxious at that time. So let's spend some time identifying more of these types of things. So with this, again, we're identifying people who are going to have the cognitive ability to think in this kind of logical way. It's so important, even with this brief time frame that we have, to make sure that they are really able to elicit these thoughts themselves, that they understand where it's coming from first before we move on. And one thing that I know I find for myself when I'm going to do CBT or brief CBT and I want to do like a thought record, something of that nature with them, it's so tempting to just rush into doing that thought record, getting to the disputing of the negative thought. And so I have to remind myself quite regularly, we need to slow down. We want to make sure that we've got and mastered each of these different elements related to this skill before we move into that. And so we'll spend some time working on that eliciting of those automatic thoughts. So we need them to be able to do it in session. And of course, for that all important brief CBT between session work. So in session, I'll talk about hot thoughts with my clients. I will talk to them about the fact that these are going to be those thoughts that are going to occur in combination with a change that you experience. a lot of times this is a really nice way to help them recognize when it's happening at first outside of sessions. It's not always easy to start bringing something into our awareness that wasn't previously there, especially when they don't have the help of the therapist in session with them all the time. So I'll say to them, okay, we're going to practice doing this in here so that when you're outside and you notice a change in how you're feeling, that gives you sort of the cue to pause, stop, think, what just happened? Did a hot thought just come into my mind? So in the session, even if we're talking about something different, I'm going to be paying attention to any verbal, any nonverbal cues, something that happens that alerts me to the fact that a shift has occurred. We were talking about this thing. Suddenly there was a shift in this person. I noticed maybe the tone, the way they're holding their body, their facial expression, maybe a smirk happened, something that tells me there's something else going on and related to this. And this might be an automatic thought that I want to look at. So if I notice this change in my client in session, I'm going to bring it to their attention and I'm going to say, let's stop for a minute. I'm going to pause here. I'm going to interject. Let's see what this was about. I noticed this. Let's talk about it. And very, very importantly, a lot of times, we are taught in our programs that we are rephrasing what people say, we're reframing what people are saying. And in the situation where we're practicing identifying and describing automatic thoughts, we have to resist that urge to rephrase. We want to say it back to them exactly the way that they said it so that it really, really resonates. This is a case of use the client's actual words here. And to help them get to the specific thought, to narrow in on it. This is, of course, going to be where we use those motivational interviewing, basic skills, the ORS questions, those types of things. And we're just going to say, I noticed things like, I noticed your change in your tone. I noticed the volume increased. Tell me what's going through your mind. Open-ended statements, give them that opportunity to start flushing it out so that we can say, okay, there was the thought, and help them recognize that connection. Sometimes it's not always easy for the person to get there. They might struggle. Again, it's not easy to bring things outside of the awareness into awareness. So we might want to add in some additional helpful questions. And you can think about what are other questions you might be able to ask that are going to help them home in again on what's the specific automatic thought that was occurring. So we can help them with this by identifying both in situations and in the feelings before you even get to the thought to help them identify, okay, so this situation was happening. When did it happen? Is there a thought that comes to mind when we think about the timing of this situation? Who was with you? Is there something that occurs with the way you're feeling about it based on who was there? What about specifically what happened? Is it truly something related to the situation itself? Who was doing what? What were the behaviors? So to help them sort of go, oh, you know what? The event was fine until this person showed up, and that's when I started to feel differently. So we can ask situational questions to get there. We can ask feeling questions to get there. So what were you feeling before the situation started to happen? And then during and then after, to help narrow in on when did the feeling start to change, help them grasp specifically what was occurring, when was it occurring, so that they get to know better themselves. Where is the part that I am having the reaction to? And I, again, just like we said yesterday, I love a good scaling question. So you'll see them pop up through everything. But can you rate your mood before, after, in the middle on a scale of 1 to 100? Where did it go? If 1 is absolutely in a great, most positive mood, and 100 is I am enraged at the end, right? Or whatever the negative feeling is that they are able to identify that they felt. And then the thought, we can get with them about that. What made you feel that way? What other thoughts were present? Because when we're eliciting those automatic thoughts, we want to get as many as possible to start. We want to go, what else did you think? What else? What other thoughts were present? Once we have all those thoughts, then we can say, okay, which one was the most bothersome? And then start to get into, okay, if it's true, then what does it say about you? We'll start identifying more. What are the thoughts really about, right? But we can help them in session to sort of understand for when they're outside of session, how am I going to recognize the automatic thought? The more we help them do that and get comfortable with it in session, hopefully the more they'll be able to do it outside of session. And so again, I will just continuously reiterate between session work is so important. It's of course so important in brief CBT. Again, we have to make sure that they're actually doing these things and ready to do it on their own. But for anything, every single technique that we use, we want to physically see them doing it on the outside and encourage them doing it on the outside. So you can do this in a variety of ways. And this is where, CBT traditionally will use things like thought records. And we're going to talk about my personal favorite version of a thought record. There's a million and one out there, but we'll talk about that one. Thought records are really, really popular. But for some people, doing things in that type of very specific way is not necessarily going to work. Maybe we can ask them to start out at least by keeping a notepad, whether it's a physical notepad, is it a notes in their phone and their iPhone that they can use. And I want to point out in the chat, Kay Braxton, somebody in that room, said, if the thought is true, what does it say about you? Does elicit an intermediate belief. Yep, via rules and attitudes. So, right, you're starting to see, okay, it starts to dig back into some of those more core beliefs where those automatic thoughts start to help us see those things. Absolutely. Yep. Yeah. So that's a great insight. So they can keep a notepad. They can attempt to list any automatic thoughts that they identify throughout the day. And again, we encourage them to do that by saying, notice when you feel differently, right? Maybe they can do it in the moment. Maybe it's an end of day check-in. Again, looking at the person and what works for them. Are they the type of person who will effectively do this in the moment? Or do we want to say each day at the end of the day, do an inventory? Each week at the end of the week, do an inventory. What's going to work best for that person? But maybe they keep a notepad. Maybe they're more visual. We can give them a printout of that triangle, right? The situation, thought, feeling triangle, and say, okay, at the end of the day, at the end of the week, think back. Let's look at instances where you felt strong emotions. Can you name some? And then can we walk back from those and come up with the automatic thought? What was the thought in between? But for some people, having the visual is really helpful. And for others, you can start out with those first three sections of that thought record. And I would say to them, if I've had the opportunity to practice the thought record in session, because of course, I'm never going to give it to them without having done it together. If we've had the chance to do that, then I might say, just, identify just one or two times when it happens over the next week. If you happen to do more, great. But I'm looking for 1 to 2 events that lead to some kind of feeling and see if you can come up with that thought. This is where, if you're using a thought record, temptation can come in to say, we're going to keep moving and move on into disputation. But we've got to be slow, methodical about this and make sure that they come back into session and that they've really successfully been able to do this piece on their own before we move into that next section. So we're doing it together in session, and then we're having them do it outside of session and bring it back to us. So as I said, I was going to show my favorite thought record. Now, this is from Psychology Tools. I know it says Psychology Tools free at the bottom. I will just note that if you want a version that doesn't have an example on it, you do pay. So I have a subscription to this one because I like a lot of the tools that they have here. And we'll talk a little bit more about why I like this one in particular, but you can go out and find a million different ones. I actually keep probably 6 or 7 different versions of a thought record, and I determine which one I want to use, again, based on the client, how they work, what functions best for them. For some people, this one can be too overwhelming. So I'm not going to use it for everybody, but it's my favorite. So I'm going to tell that person, you are not big no sign over these pieces that go beyond identification. You're not going to go into that. We're going to start with that, normally what we would consider the ABC, the activating event, the belief and the consequences, right? In this case, it's looking at it situation really as your activating event, emotion or feeling being the consequences, and the negative automatic thought being the belief. So the reason I really like this one is because it gives these prompts, and I know you cannot see them very well at the bottom. I'll get I'll kind of tell you what's on them in a moment. But it gives these prompts at the bottom for when they are on their own. It helps them remember exactly what it is that they're doing with this particular record. So in this case, where it says situation, and this person was saying, I yelled at my 3-year-old, woke up the baby, et cetera, et cetera. At the bottom, that's very difficult to see. And I even have to lean in to make sure I read it correctly. It says, describe what was happening, who, what, when, where. So it's going to remind them of the things you're reminding them of in session. This is why I like this one. And I also like it because once they've done that, she's identified this situation here. When it gets into the feeling, and I do like that it does the feeling first here because that's usually what they notice first before the thought. When it gets into the feeling, what it asks her to do at the bottom is it asks her to rate the intensity of the feeling. And I don't really see that on a lot of thought records. I like that particular element. Again, because we're getting baselines. And I love a good baseline. I love a good way to measure something so someone can see the effect of it at the end. So even if I don't use this particular thought record with a client, I still ask them, let's rate it. I add that in because of this particular record that I found. And so this person started out by saying they felt 90% angry, 90% sad, 70% guilty and ashamed. And when we get into that automatic thought, it's also going to ask them to rate on this particular thought record. And I like this as well for whichever version I do, because I get to say to this person, and this is what it says at the bottom. This one says, identify one thought to work on, what thoughts were going through your mind, what memories or thoughts were in my mind, and they can rate the certainty of it. So this is how much I believe this. And this gives us and them that information about how strong is this belief that I'm now having to work on. And we're saying, just stop there. Big X over the rest of it. We're just going to stop there. And of course, doing this with our clients so often can start them off just in understanding, oh, there was a thought that occurred before I had this feeling. Sometimes that is enough to start loosening the strength of that thought, maybe just a little bit right at the beginning. So this is one example of a thought record that you can use. I'm sure you all have versions yourselves. I encourage you all to be cross-sharing the different resources you have if you are not already, and the things that you really like that you find. But that's why I share this one, because I really like this one. And part of this too, when we're talking about identifying those maladaptive thoughts and feelings, is going to be recognizing and talking about cognitive distortions. So this goes back and forth for me personally when I am doing brief CBT or CBT in general with my clients, whether I have them start to work on understanding cognitive distortions first or start on eliciting the automatic thoughts first. Again, it depends on the client, but you can go either way. In this example that I'm talking about here today, I have this second. Either way works well, because both are going to give them information right away to help them understand that there are some thoughts and ways of thinking that I have that are probably not helpful for me. So again, we combine this together and we start to recognize and name those distortions. In session, what this is going to look like, of course, we're going to introduce the concept. We're going to let them know these are frequent themes that are often going to drive those maladaptive automatic thoughts or that negative thinking that we have. And then we're going to tell them too, each of these distortions is likely present some of the time, but we tend to favor some over the others. And then what I'll do with my clients, this is what I like to do. You work through it and figure out what you like to do best with yours. But what I like to do is I like to start my review of cognitive distortions at least a little bit with them in session. Sometimes we will get through a full list of cognitive distortions and a discussion related to them. In session, we'll get it all done. Sometimes I might only have the time to start and go through the first 2 to 3 cognitive distortions, but at least making sure they understand what we're looking to do together. And if we don't have time to finish it in session, that's going to be the between session work. I'm going to say continue what we were doing today in session on your own, and we're going to start our next session by talking about where you ended up. And so what I'll typically do with clients is I want to say, I know each of these is going to be present at least once in a great while. but some are going to be more so than others. What I want you to do when we talk through these and we're looking at different scenarios about them is to identify the ones that really resonate, the ones that really speak to you. And as I go through the list with them, I will be looking for, again, those little bits of changes in the way that they are, responding to us talking about and learning about the distortions. Typically, what I find my clients will, I'll start, let's say I'm talking about, I know a popular one is should statements. So many clients say, oh, yes, that's me. A lot of times we'll get to should statements and I'll explain what it is and I'll hear like a little, oh yeah, or there'll be kind of a movement. And I go, okay, this one's clearly going to resonate. But others, it's not so obvious and we have to ask them to really think about it. What I find though is when we finish going through it, more often than not, most cognitive distortion lists have somewhere between 12 to 15. They do vary a little bit. But what I find is most clients end up with about 5 to 8 that they tend to say, yes, I do this and I recognize it at least some of the time. And so 5 to 8 is a lot to ask somebody to keep in mind, to remember. That's going to be a little much. And so I'll say, let's highlight the top 3. And at that point, I want them to start identifying on the automatic thoughts that they're identifying. What is the cognitive distortion or distortions that you are experiencing? So now you've started identifying automatic thoughts, you know when they're happening. Now we also know what types of cognitive distortions you're experiencing. Let's put these 2 skills together. On this automatic thought, what were the distortions? So it's going to build off of that. And again, I'm going to stick with just the top 3 usually, because for most people, it's going to be a little difficult to hold in their minds the remainder. Now I'll send them the list. I'll give it to them, the full version, so they can go back and look at it. But I want them to get really comfortable in understanding them themselves. So this is what I love. One of the things I love that I find so effective about brief CBT is just getting into, again, the identification of those maladaptive thinking patterns and then calling it what it is, naming the cognitive distortions that were happening starts to loosen the power of the thought really quickly for most people, because that's when they start to go, oh, you mean that thought has a name? And that name for that thought is a distorted way of thinking. A lot of clients start to come back into session, at the next session and go, I recognize that I was doing that black or white thinking, or I recognize that I was mind reading. And so it starts to loosen the power right away. So when you think about this for brief services, if we have individuals who are only coming for a few sessions, think back to that data from yesterday too. If they're the people who are likely to drop out early, we may have already given them this skill quickly. This is potentially going to already be enough to help some people start to feel some level of improvement. And if we've got people for a short period of time, that's a really, really, really good thing. And so for brief CBT, I love that. You get right into this and we can start to give them that right away. And then again, as I said, I'm going to have them add it to the thought record. So where I would have them do that, you go there first, where I would have them do that is on this thought record, if they were using it, where they put the thought, I'm going to say, all right, start to add in. What are the distortions that you can relate to this? And if somebody's saying, I must be a very bad person not to be happy to have these healthy kids, right? They felt really strongly about it. Maybe this is the version of cognitive distortions that I gave to them. And we've already identified they have certain things that that they are really major at with their cognitive distortions, the ones that are big for them. And so they might go, oof, wow, well, that was a big mental filter that I was doing. I'm only focusing on the times when I have not done what I think is a good parent would do, or I'm labeling myself, right? So they're going to start writing those things out. So just like with thought records, some of you probably have lists already of cognitive distortions, and you know that there, again, are 1,000,001 versions. This is one version, and this is something that I, again, like to have a lot of variety of versions on in order to give the client the version that's going to work best for them. This particular version is one that I give to individuals who need things to be concise, short, sweet, to the point. This one doesn't go into a lot of detail. There are other ones that I'll use that are for my very logical clients who want a little bit more. And then there's one that I've got that's very colorful and it has a little bit of art on it. And so for those people who are drawn more to that creative artistic side, I'm going to give them that. But whichever you choose, it's all going to have generally the same information. Again, some of them have up to 15, though, distortions. So you just want to look at it and see which ones are going to work best for the individual that you're working with. So, continuing on that cognitive element, most of what we're doing, of course, in brief CBT is this piece of identifying and then challenging. And that's where the cognitive focus stays in brief CBT. So, we're going to move from that identification of our maladaptive thoughts and beliefs, and we're going to switch into challenging those things. So, after we've understood how those automatic thoughts work, then we're going to start shifting that focus, but not before. Not before they've come back and effectively identified some thoughts when they can really start to see them in action. That we can make sure, okay, now's a good time for us to go forward and move on. And of course, if some of you have probably used this type of thought record before, we're going to start working on those counter statements. We want them to start shifting their own negative thinking. We can jump in, we can help out, but we're really working with to get them to identify it themselves so that they have a real salient way of disputing it for themselves. We don't want them to rely on us to be able to do that. So we also want to make sure that we move right from the identification into challenging. This is really a big skill, and it will take several sessions. But if we have a break between identification and then maybe we've kind of interjected with something else in between, and now we're trying to come back to the challenging, that can be a little difficult because, again, this is a big skill. We really want to be able to put it all together. So you want to make sure that we are combining these things as much as possible. We're keeping consistency in those sessions. So again, brief CBT is going to get this continued through each of our active work sessions. We're doing all of this in those active sessions. So in identifying our maladaptive thoughts, we started with those first three columns and just noting that those first three columns are that triangle, that situation, thought, feeling triangle flattened out into that line. And now we're going to move into the challenging. We're going to start putting the thoughts on trial. And again, we're going to need a lot of practice on doing this to make sure it's something they can do on their own. One thing I do like to really reiterate to my clients too is I like to say, I know we're doing a lot of work and it's taking a lot of time right now to do this. But the idea is, and I've seen it work so many times, so I can tell you that I have every faith in the world, this is what will happen for you. The idea is you're going to get so comfortable with this process that eventually you're not going to need to write it down. It's just going to start to become second nature and natural. Right now, it's going to take us time, but like anything else, it's like riding a bike. It's going to get easier and easier. And I like to let them know that so it doesn't feel like, oh my gosh, am I going to have to think about this whole thing every time? Am I going to have to pull this paper out every time this comes up? That can feel daunting. So I like to give them that hope there too. And my favorite thing to kick off on when I am starting to talk about challenging is to introduce Socratic questioning. So, this is a technique that some of you are probably familiar with, but it is really, really great in helping to start that cognitive restructuring process. It's going to help us do the disputation. Socratic questioning is, of course, based on philosophy, based on Socrates. It is not unique to therapy. It's used by teachers, it's used by legal professionals, it's used all over the place, but it is super effective and it's very effective in therapy. It is a very, very great addition to your brief CBT. So just like I will teach the cognitive distortions as sort of a separate skill that we are practicing, I will have them practice, okay, now we're understanding the distortions and the maladaptive thoughts. Now let's practice doing some of this Socratic questioning. Let's get good at disputing these thoughts here before we move forward. And so what is it? If you're not familiar with Socratic questioning, What it is an open-ended question, right? It is going to be something that we are able to use with them to help them understand what's going on with their thinking. It's typically concise, it's open, it's focused, it's neutral, and it's going to be based on that idea that that original interpretation just might not be accurate. So Socratic questioning is essentially exactly what we're doing when we are in that disputation phase of our thought record. So there's a million and one questions you can come up with when it comes to Socratic questioning, or they can come up with. But some examples of it are going to be what's the evidence that supports it? What evidence does not support the thought? What other angles exist that you might be missing? What other factors may exist that could be impacting the situation? Basically, what else do we need to look at that we're not considering when we come to this automatic thought? Where are all of the pieces to this puzzle? Let's look at it from this non-judgmental, we're sort of observing it, right? And so it helps them to start do the disputation. And this is where, once we've kind of talked through that, what does this look like? We can start to get into that next section of the thought record. So again, this is using that example of the thought record that I showed before, where we crossed out this section previously. Now we're going to start moving into this section. We've already got these first portions done. Let's take one of those negative automatic thoughts that really was the most powerful for them recently, and let's start to practice that disputation and start getting the evidence for a new and alternative thought. So let's lay out, this is going to lay out in this particular thought record what these next columns are all about. So that fourth, fifth, sixth, and seventh column, what those are each about. In this one, in this particular one, they build in Socratic questions, which is also why I like this one too. Columns 4 and 5 are Socratic questions. Again, Socratic questions are disputations, right? Or they can be. So column 4 is going to look, using Socratic questions, at evidence that supports it. So it's not disputing it, but it's saying, hey, is there anything out there that says this thought